So welcome to our discussion on AI for social good. What does that mean? Throughout the day, you heard from our keynote speaker, from various panelists, and Dr. Craig Watkins about the important, notion of trust, ethics, responsibility as we develop and utilize the AI technology. So today in this panel, we will delve a little bit deeper into how AI really can do some social good if designed right, used correctly, or how it can really create peril, if you will. I'm honored to have three panelists here today with such unique perspectives. Ms. Aleena Tomy is an international student from India pursuing computer science at Texas State University and a former proud Riverbat. Woo! Aleena actually was a student intern with the Center for Civic and Government Engagement under the direction of Mr. Brian Port. And there was an event there, and I remember Aleena had a little presentation, and we were just blown away, and the rest is history. She joined us in this symposium. Her deep interest in AI ethics stems from a passion for ensuring that AI technologies are developed and applied in ways that benefit society. Aleena believes that responsible AI can be transformative in addressing societal challenges and risks, creating a more equitable future. Our next panelist, it's just such an incredible honor. Recently, I have seen Professor Greenburg in the news, at LBJUT AI Policy Symposium, everywhere. And I am just so thankful that you came straight from class to be here with us today. Professor Greenburg is a professor of practice and fellow of the Max Sherman Chair in State and Local Government at the LBJ School of Public Affairs. She's also a professor of practice at the Steve Hicks School of Social Work. Additionally, she is the LBJ School Assistant Dean for State and Local Government Engagement. She is a primary researcher for and is a past chairperson of Good Systems at the University of Texas Grand Challenge regarding ethical AI, which we heard a little bit from Dr. Watkins earlier today. Professor Greenburg is a member of the board of the Austin Convention Center Enterprise. She also serves on the Austin Smart City Alliance Board of Directors and the Austin Forum on Technology and Society Advisory Board. Previously, she was a member of the Central Health Board of Managers and a member of the City of Austin Housing Investment Review Committee. Greenburg has served as a senior advisor to Austin Mayor Steve Adler, and she was a Texas State representative from 1991 to 2001. What an incredible journey. And she chaired several House committees. The whole time, we can just talk about Professor Greenburg's magnificent achievements. Her teaching and research interests include technology policy, state and local government, housing, homelessness, transportation, healthcare, public finance, and campaigns and elections. Recently, she has had funding from the National Science Foundation, the City of Austin, UT Good Systems, the IBM Center for Business of Government, the Cisco Foundation, Microsoft, Mitra, and the state of Texas. Welcome, Professor Greenburg. And Dr. Maaz Amjad is an assistant professor in the Department of Computer Science at Texas Tech University. Before joining Texas Tech University, he was a provost Provost Early Career Fellow at the University of Texas at Austin, Texas. Dr. Amjad holds a Ph.D. in computer science, and he uses artificial intelligence, computational linguistics, and natural language processing to create solutions for addressing socially compressing problems. Specifically, his work focuses on combating misinformation, detecting hate speech, and enhancing public health surveillance. At UT, Dr. Amjad was a part of the team involved in developing AI technologies for improving opioid reporting prevention efforts in Texas. Dr. Amjad also serves as academic editor on editorial boards of many journals such as PLOS ONE. He is very passionate about contributing to scientific knowledge, promoting underrepresented communities in computing, and especially in increasing access to education. Wow, please another round of applause for this incredible panel. Okay, so we have a few questions and we will just go around. So please share about your work in the AI space and what you see as pressing ethical and societal concerns related to the exponential use of AI.
So it was during my internship at the Center for Government and Civic Service at ACC that I got to know about AI ethics. I worked on a proposal for a new degree program called the AI Auditor Degree Program. You know, ACC is very futuristic. So during that program, I got to know that, we aim to equip students with both technical as well as ethical expertise so that they can not only provide ethical oversight, but they also have the technical tools to mitigate the biases that are present in the AI system. And it was during my research in the proposal that I got to know that there are some ethical concerns that both students, common people, and also businesses feel. And that is about the lack of explainability in AI, which is called black box model. So these black box models, you give them an input and it gives you an output. But how do you actually know what all sources that AI used? That is the explainability issue. And for this, I researched and I got to know that Stanford University and the University of Washington, they created an auditing framework to better understand how AI systems make decisions when diagnosing skin cancer. These AI systems are often like a black box. You see the result, but you don't know how it got there. So the researchers used special techniques to look inside this black box and found that while AI made many accurate predictions, sometimes it relied on unimportant details, like the amount of hair on a person's skin to make its decisions. This is a problem because those factors aren't actually related to whether someone has skin cancer, and it can lead to incorrect diagnosis. So I believe that AI has the potential to shape public policy, especially in healthcare. But for that, the policy has to be trustworthy, and it cannot be trustworthy if it is not explainable. Thank you.
I have been involved in technology policy for many, many years, and specifically with AI ethics, responsible AI, development, implementation, and policy regarding AI for about the past 6 years. And this is a major focus at the University of Texas at Austin. We are in the year of AI. President Hartzell declared beginning January 1, so it will end December 31st, not academic year, but calendar year for this. It has been a very busy year. I just finished my term as chair of Good Systems, which is the Ethical and Responsible AI Consortium at the University of Texas at Austin. I'm still on the board of Good System and involved with a major research project with Good Systems that I'll come back to later because we're working, one of our partners is actually Austin Community College on this project. There are many ethical issues revolving around the responsible use of AI. And certainly, you mentioned one, OpenAI versus the black box and explainability. Others, of course, include privacy, and privacy is a major issue. We know that our data is being scooped up by the, I don't know, millisecond. We say we know that, but do we know that? Do we have agency over that, right? And that, I think, is a very important aspect. Privacy and agency. Beyond privacy and agency, which I think are foundational, you have to look at the other repercussions of AI. AI has promise and it has peril, right? So think of two sides of the same coin. On one side is promise and the other side is peril. And there is great promise, and we'll talk about that in healthcare, in work, in housing, and in other social issues. However, there's also peril. And I think that begins with privacy and with having agency over our data. We have to have transparency. In addition to explainability, we have to have transparency, right? We have to know what is being used, how it is being used, and have that transparency. And we, of course, need accountability, right? What happens when there isn't accountability? What will be the mitigation if there is not accountability for that privacy, right, that transparency? We need that accountability. We also, of course, and I know that my friend Craig Watkins talked about this earlier, need to be cognizant of the algorithms, right, and the bias that is in the algorithms. And I know, we all think we don't have bias. Each and every one of us has bias, right? It's there. And all the algorithms have bias. Are you ever going to 100% do away with bias in algorithms? What do you think? No, the question is, how do you minimize that bias, right, and mitigate for that bias? And of course, you need trust and trustworthiness. However, if it's not explainable, if it's not transparent, if you don't have agency, if it's not accountable with mitigation and to the extent we can free of bias, how are you going to have trust, and how is it going to be trustworthy? So these are just some of the issues that we consider when we're thinking about responsible and ethical AI, and how do we use that AI for promise rather than peril. Thank you.
Dr. Amjad, same question for you.
First of all, thank you very much for the invitation. I'm really grateful for this opportunity, especially sitting among the experts, and certainly I'm very grateful for that. Is it okay now? Okay. Certainly, I think the question that is being asked now is how we make sure the responsible use of AI. And I just want to ask one very simple question. All of us know ChatGPT, right? And we use every day. So the question to ChatGPT was asked, if we have a word strawberry, can you tell me how many times the character R appears in that word? And if you see the response of ChatGPT is 2, right? Then the second time the question was, are you really sure that R appears only 2 times in the word strawberry? And it was stubborn and says, yes, indeed, is again 2. And then one more time, just to clarify whether, are you really sure? And then say, yes, I am 100% sure. Until then, this is one of the earliest model of ChatGPT. And then the question was, how we make sure the use of AI being responsible and ethical, right? How we can make those technologies and algorithms more responsible so they understand what the question we are asking, and then the response, how we can align to that. So then the new models of ChatGPT, they call as O series, O1 and O mini, they are claiming to be more reasoning based models where people can really ask and challenge models why you bring up these questions, and then that answer and then it will give you the reasoning behind why I brought that specific answer to that. So I will certainly take you to other slides, but certainly I will get back to Nina, and then we will we'll try to continue the conversation. And I think I brought some good slides, because the way I teach is by visualizing things. So this is how humans can really understand that. So I brought some good examples, and then certainly I think those examples will really help us and guide us and navigate us, really like understand how we make sure that we are responsibly using AI in our daily life, actually. Yeah.
Thank you. Next question. So throughout the day, we have been hearing, as you mentioned, Professor Greenburg, about the importance of how AI technology is developed, embedded, utilized, and the importance of having those regulations, the guardrails to ensure that it is responsible. So the question that I have is, what are some, in your opinion, what are some policy implications for AI adoption that should be considered? And you can look at that from various perspectives. It doesn't have to be healthcare, or whichever, if Aleena, you'd like to go first.
Okay. So I would say that we all know that AI perpetuates biases because it's learned from data, and data is collected from us, and we are biased. So, and through the Stanford study, we also got to know that it is possible for the AI system to be audited. So we need to have explainable AI algorithms. Through that, we can make sure that the AI system is free of biases. Actually, it cannot be free of biases, but it can be controlled. And also, my second point would be, who will be the people who will actually audit the system? We need to have diverse and collaborative stakeholder engagement, because the more perspectives we have, the more experiences we have, the more inclusive the AI system would become. And that would be my answer to this.
Oh my goodness, policies. So set the stage. There is governance, or should be, of AI. And what would governance entail? Well, one form of governance is regulations. Regulations require action by elected officials. They become statute, whether it's at city council, county commissioners, the state legislature, Congress, haha. So that's one set, okay? And those, as I said, require actual legislative action by elected officials, and they become statute, law. Beyond that, we have other forms of governance. You've heard about frameworks and guardrails and policies. Okay? None of these require legislative action, and they're not law, they're not statute. Policies are typically formed by those in agencies, and you may also have, guardrails or frameworks to use. Okay, so that's kind of the governance terrain. Within that, we have policymakers at the local level here in the United States, and cities. Cities are at the state level in our state legislatures. At the federal level, we have not had congressional action, but what have we had? Somebody shout it out. What's happened at the federal level? Biden's executive order, right? The framework for an AI Bill of Rights, and NIST, National Institute of Standards and Technology, having its risk framework. And we have at the international level, the EU, right, which has now implemented its regulations, UK, China, and others. So we have a big universe of policies and policy making from one end of the continuum, which is just like frameworks, all the way to regulations. When we look within that, what do we need? I do believe that here in the United States, actually, we need congressional action. There's only so far, and it is far-reaching, Biden's executive order, because the agencies affect so many. But what you're seeing is that cities and states are stepping into that void, that vacuum, because Congress has not acted. So I do think that we need federal legislation, and I particularly think that we need to look at how we inform the public. We do need stakeholders involved. If it's healthcare, we need our healthcare stakeholders involved. We need to co-design and use human in the loop and design thinking when developing this. And we must, I believe, have some kind of certification, right? I'm not sure who would do this, but some kind of certification of these AI systems so that when you are using them, you know whether or not it is certified, you know the standards it's meeting for accountability, transparency, you know how often it's being audited, and then you can have trust. So I think that that would be a really important aspect.
All right, I will just ask you to just watch this small video. Very thoughtful, by the way. I personally like that, and certainly I'm thinking. So if we play this, yeah. So just pay attention on what this small bird can do with 200 billion neurons. So this small bird has only is basically has only 2-month age, which has 200 billion neurons and is basically acting, planning to survive, looking for food, and understand what is happening around the bird. My question is, if we have an AI technology which has the same number of neurons, let's say 2 billion, can that technology take into consideration the physical aspect of life and involve experiences in their decision-making process? My guess, no. That makes us a unique human being. So if you see that the bird is really trying to understand hard and plan and see how I can get the food, having the same number of neurons as we can provide to the AI. And neurons means the data points. But this human being can make, I think, more important decisions based on the same data points versus an AI model. And that is why we have to be informed about why we are using AI and how we are using AI. The other thing I just want to talk about is we should be also asking the question, what has happened in the last 10 years that we start talking about AI from suddenly, like what has happened? And so there is a law that says that basically we did not have computational capacity to do the modeling. And as soon as we have developed that capacity, AI was already there. So interestingly, in the human history, ChatGPT was the only app which got more than 100 million users in less than 2 months. This is amazing, right? The other aspect is, if we have AI, AI is not new. People have started working on probably in 60s and 70s. But this graph is called Gartner's hype cycle. And you might want to check what this cycle is, basically. So it has 5 stages, and we are in this stage now. And what is happening now, all the CEOs, all the enterprise, big companies, they are creating hypothetical applications of AI. We just want to involve AI no matter what, without even thinking whether AI can really solve this problem or not. So we are exactly in this stage now where we are thinking a lot about hypothetical application of AI, and that is the first stage. The second stage, which is very interesting, we are thinking that once we arrive to the point which is a peak, we are really going to do a great job. But since the beginning was on a hypothetical base, and once we arrive this point, we realize, I think our expectations are not fulfilled somehow. And then we said, okay, well, now I want to do something different. Let me rename automation as AI and maybe calling this with a fancy term, actually. Because my initial thought was I am going to use AI no matter what. And that is why the last question that we were asking, so the slides that I am showing I just adopted from, so we had a talk, and the speaker really brought the perspective from the aviation point of view. Because the question was, if we are using AI in aviation, there is no way we can make a nano small mistake. We cannot do that because we are taking human lives on board. We cannot give airplanes on AI base and say, well, okay, no, you run the aviation actually. And that is where the question was, where we are leading now in future. The last slide I just want to talk about is this. It's a very, very, very nice analogy actually to think about. This small animal, actually the seabird, we can call that the sea animal, has 2/3 of the neurons in hands, not in the brain. So basically those hands are really helping to do the tasks, right? So the question for thought for all of us is, if we consider AI to replace us, I think that is not the plausible way moving forward. However, if we use AI as a partner to improve our decision-making process, I think we will definitely move forward in a very nice way. So directions will be very clear, plausible, as well as ethical as well. So this small example really help us understand, if we use AI in addition to our hands, I think our hands are going to be more useful. So it's basically using AI to complement the human skill, because the decision-making process of human cannot be replaced by AI. No matter how smart AI can be, we cannot replace that. So again, back to the point, these are the small points we have to take into consideration to understand that why we have to be informed of ethical and responsible use of AI.
Thank you, Dr. Amjad. This was a perfect illustration, as you mentioned, Dr. Greenburg, the importance of policy, and it sounds like not just policy, but laws, right, regulation, which, Dr. Amjad beautifully demonstrated, because of the lack of capabilities that AI alone has. So we have to be the drivers, and it starts with policy. Can you share with us some of the examples of the work that Good System does? I mean, we hear a lot about the collaborative work that you do.
Absolutely. So you hear GAI, that's generative artificial intelligence. You also hear AGI, artificial general intelligence. And that's what Professor here was alluding to, that we do not have artificial general intelligence. And should we have artificial general intelligence, or could we, right? I completely agree that artificial intelligence should be, make new friends but keep the old, right? That artificial intelligence should be used to assist humans. And we have a lot of work we're doing within Good Systems. We have over 130 researchers, over 25 departments, and at the University of Texas at Austin involved. We have 6 core, what we call core research projects. One, living and working with robots. Are there tasks that robots can do that would help humans by relieving the burden, for instance? If you think of healthcare, you think of a hospital or skilled nursing where very heavy patients and clients, right? This is very difficult for the caregiver, and the caregiver could be relieved of that and using their skills for actually higher level service provision, right? So thinking, living and working with robots. Another one that Craig Watkins is involved in looks at how are we using AI in an equitable manner in transportation and healthcare and other areas. Another one looks at surveillance in cities. How is AI being used? You are being watched, all right? Your own phone is watching you, okay? And is this new? Is AI new? No. AI actually started in around 1950 in the UK with Turing, Bletchley, okay, where they were decoding the German codes during World War II. That was the genesis, right, of AI. So yes, it has become this fancy new term, and frequently it is the shiny new toy, right? So it shouldn't be that we have a toy, we have an AI, we have a technology, an application in search of a challenge. The question before us as ethicists, as policymakers, as responsible human beings should be, we have a challenge. What are the tools that would help us with this challenge? It may or may not be automation or AI, for instance. One of the projects that I am a co-lead on, one of the co-PIs, is smart hand tools. And this project specifically is looking at how can AI and AI sensors and AI feedback be used with smart hand tools to, in fact, complement the human being. So we have been working now for several years with the welding program and the welding instructors and students here at Austin Community College. You have an excellent welding program. We have also been working with the city of Austin because when you think about hand tools, whether it's a hammer, whether it's a saw, whether it's welding, whether it's a Dremel, whether it's a surgeon in the medical use, they're everywhere. And certainly with the city of Austin, because the city owns, it has departments that are Austin Energy, the airport, public works, water, you name it. There are many applications of people using tools where they could be assisted, right? And we also started working last spring with the AFL-CIO here. And in all of these, we are doing semi-structured interviews and with both the workers and the managers. With the AFL-CIO, for instance, we have done semi-structured interviews with pipe fitters, right? So the question is not replacing humans, it is augmenting humans with the future of work. Are there some jobs that perhaps will cease to exist in their current form? So how many of you actually enjoy, entering data in an Excel spreadsheet? Okay, I'm going to admit it. I'm just going to tell you, it's not my favorite, okay? So think of it this way. You may have a data entry job. However, now Excel can do that, and you can be upskilled to be doing higher level data analysis. So that would be an example. With the smart hand tools, one of our goals is to expand the workforce as far as middle skill workers. Middle school workers are those workers who need more than a high school degree, but don't need a 4-year degree. They may need a 2-year associate's degree from ACC or go through a welding program and get certification, right? And there are many other middle skill workers. We do not have enough middle skill workers in this country, in the state, in this city, in the world. And that was only exacerbated by COVID-19, but even before then. And we know that here and in many places in the country and the world, we have an aging population. So how do we increase the pool of middle skill workers? These are good jobs. And how do we also expand that workforce for people who maybe thought, oh, I can't be a welder, right? It's not for me. So more equity in the workplace, expand the workplace, and then use AI with sensors. So we have a pilot that we have used with a phone. You don't have to go buy some new fancy equipment, right? Where you have an application where you can practice, for instance, welding at home. You can have sensors that help you with that, or if you're a surgeon, many other applications that we see with AI assisting the human and keeping the human in the loop.
And one thing you said, Professor Greenburg, for the nurses in the audience, are there nurses? Hands up.
Yes.
You heard what she said. Robots to help lift the patients.
Right.
Help is on the way.
Well, yes, yes, it becomes a question, whether the question is, do you want to do data analysis or spend all your time entering into an Excel spreadsheet? Do you want to be providing care, or is your time consumed with lifting and transporting people who need your very high level of care?
Said, it reminds me, of course, of the improvement model and design thinking. Thinking about the problem, what are we trying to improve, instead of focusing on AI as the answer to what we don't.
What's your goal? What outcome are you trying to achieve?
Yeah, absolutely. Aleena.
Yeah, also when I was doing my research on the AI auditing program, I was able to see there were at least 65,000 job openings in AI ethics, AI research, AI policy analysts. So there are multiple job openings that AI is also creating. And I am pretty optimistic about it.
That's an excellent point. There are jobs that will change. There are jobs that will require upskilling or even real reskilling, going back and perhaps getting another certification or degree where you can be a manager. However, there are new jobs. Prompt engineer, talking about generative AI, how do we ask those questions? How do we do those prompts? The AI ethicist, the AI data manager, the AI policymaker. There are many, many new jobs that we are seeing in all sectors that have been created and will continue to be created due to AI.
First of all, I really want to thank all care providers, nurses, medical doctors. I really appreciate all your contributions, honestly. I think without your hard work, without your care, it's very challenging to survive. So thank you very much for doing the great work you do. I deeply admire that. One more time, thank you very much for the work you do. One thing I really want to mention, which is very close to my heart, and thanks Nina for asking this question, is the learning how to use AI is the key here. Let me give you one very simple example. So the federal government gave a project to Google and asked Google to design an algorithm so that that algorithm can help law enforcement agencies to do some decision-making process. Now, Google instantly decided to develop an algorithm based on the information they collected. So they had a very limited data. They developed a model and they handed over to law enforcement agencies. Now, guess what? The people who were using those algorithms, those technologies, had no idea how those algorithms are coming to the conclusion. What were the underlying technology that was coming to that conclusion? So law enforcement officials were using that information and making their decision, because no one told them that this is only a tool that can help you understand some factors and help you and facilitate you to make your decision. But many officials eventually had no training at all, and they were primarily making decisions based on whatever the algorithm was saying. Then, as a result, we incarcerated so many innocent people because our algorithm was saying so. Then the question came like, what is happening? Why we are targeting some people versus we are not targeting other people as well? And then there was a lot of investigations on what has happened, and then it turned out that Google primarily trained on the algorithm on a specific population, and they ignored the rest. And this is how then there was a lot of discussion on, oh, we should have helped those people who were using that technology. We should have told them this is only a technology that can help you make the decision, but not really rely on that decision actually. So as medical nurses, medical doctors. My wife is a medical physician, so I always talk about, like, do you know how to use this tool? Do you know how to handle that? Because if we are not learning how to use AI, I think then we get a lot of responsibility on our shoulders, because certainly AI can help us make those decisions. But I think if we get training on how those tools can be used, I think we can make a significant impact on our job on a daily basis. So I would really like to request to all my great physicians, medical doctors, nurses, I think find opportunities where we can learn how those technologies can be meaningfully implemented in our daily practices. So we are making sure that we are not causing any harm, as well as we are meaningfully providing the care that people need and they deserve. So that is like a very humble request, and that is what I am trying to help my students learn, that I think we should really make education accessible, and we should also include technology into that. I just want to add one more example. This is amazing. ChatGPT. So there was an experiment recently. So the experiment was the U.S. the Declaration of Independence was written probably more than 250 years ago, right? And that time there was no ChatGPT at all, right? You can do the experiment. You can go home today and you copy that declaration and give the ChatGPT and say, tell me the likelihood of this text as AI generated. You will be surprised. It will be more than 60 to 70%. But ChatGPT has no idea of that text, actually. So again, another request is all the people who are in academia, please don't use these ChatGPT-based models for plagiarism detection. And the reason, in the early morning, I think we heard one example when we did not, someone did not really intentionally declare all the rules of the curriculum, and then certainly, we have to experience some unfortunate consequences. So I would say, because all those ChatGPT-based plagiarism detections are not based on AI. Basically, we are asking AI, can you tell me if you are yourself or if someone else actually? So because all those publicly available AI tools are not designed for that. And I think I see that sometimes those people are really making a lot of money by saying, oh, we are really based on this and this and this algorithm. This is my expertise. I can 100% honestly can tell you those tools are not working. There is another tool called Turnitin, and those plagiarism tools work by comparing the text that has been stored in the database versus the new text. So there is a text similarity in that case. So, and those similarities based on math functions. So there's a lot of math behind that. But in this case, when we are talking and we are asking AI to tell me if this is an AI generated text, what we are saying is, tell me the word choice, tell me the length, tell me the punctuations, and tell me how many words we have in that paragraph. These are the very hardcore rules that we are giving to all those ChatGPT detection tools to detect if it's an AI-based text or not. So it's very unfortunate that people still are using those technologies to detect if it's an AI and not AI, but certainly those technologies are not designed for detecting AI content.
No, and higher education learned the hard way. As soon as, of course, ChatGPT came out, higher education said, oh no, we can't have that. Like, well, does that mean we can't have the printing press? But anyway, no, we can't have that. So we're gonna use these detectors. And what did they find out? Students were being accused of cheating using ChatGPT, and they weren't. So higher education did pivot and say, okay, well, like the printing press, this is here to stay, so how do we use AI? And I would say that when we think about, for instance, jobs in the workforce, there's a saying right now, AI will not replace people, but people with AI skills will replace those who do not. And so I do think those AI skills are essential, and I believe that we should start incorporating AI in our curriculum, K through 12, all the way through whatever your terminal degree is in higher education, and for our communities. Go to where the people are, the libraries, the community centers, and others. So very important to have appropriate AI curriculum. That doesn't mean that everybody is going to be a mathematician with algorithms or doing natural language processing, which is what ChatGPT is. It is scooping up everything that's out there on the internet and using natural language processing. And that's why you have these inaccuracies. It's not thinking, right? It's scooping is the best way that I can explain it, right? And so we need to have those understandings. And it is very important in the healthcare industry where we don't have enough, and thank you, providers, we can use AI as an assistant. So AI could be summarizing if you're with a patient, right? And we have seen that AI can be pretty good at summarizing meetings and notes and whatnot, and again, free you up to provide care. So that would be another example. We have seen that in the medical field, there have been situations where AI can go through more data than a human could in their entire lifetime and actually come up with a diagnosis that was correct and treatment. But this is assisting. The healthcare provider, yes, still has to use AI as a tool alongside their own thinking. As I tell my students, could this possibly be correct, right? You just don't take things on face value. The brain is a filtering tool, right? Could this possibly be correct is what you need to ask yourself, and use the AI, yes, as an assistant. And when we talk about the bias in the algorithms, I say to my students, okay, AI is being used in hiring. It has been for quite a while. And AI will go through the resumes and kick out a bunch and send you some. So let's say that you want to hire a new police cadet class, right? Those entry police officers who go through training. And you just tell AI, well, look at these resumes and send me the ones that we should then have take the test and interview and do, all the different physical tests to see if they should be part of our new police AI training class. Okay, well, if you do not use your human thinking abilities and you do not look at the data behind it, and let's say you want to have a more diverse cadet class that reflects the community. If you don't do that, what are the resumes that you're going to see? What do you think? Who are these people going to be? Anybody? They're going to be Anglo men who are over 6 feet tall, right? I mean, pretty much that's what you're going to get, right? Because it's just going to go back and scoop the historical data on who's been in the police force. Another example is, and I think this was in Spain, but don't quote me. There was I think it was a police department in Spain that decided to use an AI system for deciding whether or not to intervene and take action in domestic violence cases. And it was using, historical data and situations to predict if this was going to be a repeat. And not doing anything else. Not using this tool as an assistant to help look at data. And the end was gruesome for a woman. Okay, so when we think about the issue of using AI in society, right, we have to keep in mind that AI is not thinking. We do not have, right, artificial general intelligence. And we have to keep in mind the skills that are human and that we need. And in fact, when you're looking at careers now, what kind of skills do we need? We need thinking analytical skills. We need critical thinking. We need creativity. It's not creative. We need empathy and social skills and leadership skills. AI does not have any of those.
You know, we have colleagues from the Board of Nursing, and as you were talking, I was thinking about in the healthcare profession, no matter what profession, but in healthcare, the concept of clinical decision making and professional judgment is non-negotiable, right? That is what sets us apart. And all day we have heard about the importance that, you know, the capabilities of AI technology in extrapolating, maximizing, pinpointing, but at the end of the day, in addition to that human-centered approach, is that professional judgment, that clinical decision-making, that as a registered nurse, I know we cannot delegate, right, Dr. Hooper? Those things cannot be delegated. So I wonder even if AI could be, from a regulatory standpoint, Dr. Hooper, I'm going to reach out to you later. I want to know more about, would the concept of delegation even come into play when we think about technology like that? It's just such a fascinating topic, and it makes me so excited because for long we have heard about the administrative burden on our healthcare professionals, just adding the burnout, the attrition, the turnover that we're seeing, and then we have this AI capability, this technology, but how are we leveraging it? That is really the question.
I think you need to think about risk, right? There are low-risk ways in which to use it, and there are high-risk ways. And I think when you start to implement it, you start, obviously, to me, with the low risk. So some of those purely assistant administrative functions, or we think of them as such, yes, it can, probably a lower risk is data entry. A lower risk is summarizing a meeting. A lower risk is scheduling meetings. I mean, how much time do you really want to spend scheduling meetings, right? So that's a lower risk. We can move to, medium risk, where the AI is sussing through data and assisting us in making decisions. Then there are very high risk. I was asked about a year ago in an interview, what are some of the ways in which you think that AI has great promise? And I talked about the situations where it can sift through so much data that a human could not, and actually help us make a diagnosis, or help us with, interventions. Help us, not eliminate us. On the other end, I was asked, what's your scariest? And I have to say it was AI on the battlefield, like autonomous, weaponized, autonomous on the battlefield. I consider that to be very high risk.
I would also like to add that since we know that AI has risks associated with it, we should also not just keep on thinking about the risks and how to mitigate them. We need to start advocating. We need to advocate for committees or a board of people who can come together, who can mitigate the bias, who can make the organizations and businesses aware of what the AI systems can do and cannot do, and how they can impact the public.
Thank you for, yes, we tend to go towards the worry, the negative, and we want to be excited because of the promise, right? The great opportunities. So tell me, Aleena, what excites you? In, closing, what excites you about this whole new world of AI technology?
So I would say that what excites me about AI is that it has the potential to reduce social inequality and make healthcare accessible. And I would like to cite an example. So just consider there is a woman named Nalini, and she is an expectant young mother who lives in a rural village in India. And she has limited access to healthcare resources and is she's very worried about her pregnancy But then she discovers M-Mitra. So M-Mitra, M stands for mobile, and Mitra in Hindi, it means friend. So it's a mobile friend. And that mobile friend gives her updates about her nutrition and prenatal checkups and kind of keep track of her pregnancy routine. And with the help of, so what I'm trying to say is M-Mitra is a real thing. It's actually, M-Mitra collaborates with Google AI and uses Google AI's prediction to make sure to identify women like Nalini who don't have access to healthcare services. And through this, Google's AI has actually reduced the maternal as well as infant mortality rates. And this is what actually inspires me about AI, because it has the potential to reduce social inequality, and not only healthcare services, it can actually make financial services also accessible to a lot of people. And that is what I believe in when I talk about and when I think about AI.
Thank you. Wow. Thank you for helping us see the big picture. Professor Greenburg, what excites you about
AI does have the promise of alleviating a lot of human suffering. Let's take cancer. My mother of blessed memory and my brother of blessed memory both died of cancers, different cancers, not genetic. It just, we call them the, shit happens cancers, right? And there is so much going on that is very promising right now with cancer and cancer research and cancer treatment with artificial intelligence. So that's one example. Beyond that, I do think that we can use AI to really alleviate other forms of human suffering and to help bridge these divides. When we talk about farming techniques, right? AI is being used in farming techniques. When we talk about energy, two sides of a coin. Yes, AI, we know those data centers are using a lot of energy, but could AI be used to make energy more efficient and more new energy sources? So I see a lot of areas where there is great promise in AI for humans, for human suffering, for human potential, right? And, for our world.
All right. Well, thank you so much again. I apologize. I put us a little bit behind because we just had such a wonderful panel.